Well, hey everybody, it's Sandy and welcome back to my channel dedicated to helping you advocate for your own health one topic at a time. So today I have with me a nurse practitioner, a colleague of mine, Dr. Clelia Lima, and she's going to talk to us about sleep disorders. She has a specialty in sleep, and I'm going to give her a second here to just introduce herself, and then we'll get into an interview. Hello and welcome.
Thank you so much for having me, Sandy. I really appreciate the invitation. And like I said, we are colleagues, and that's really exciting. And I'm really happy the way you are doing your channel and giving the message to your followers. It's just fantastic. So I have been a nurse practitioner for over 13 years now, but as a nurse for over 20 years. And it's always been my passion to educate patients on how to be well. And wellness for me, it has so much more than just one topic or another. So I'm really excited that we can talk a little bit more about that. So if you want just to know what I have been doing these years, I graduated from UCF with my master's and my doctor degree. I have been a faculty at UCF as well, and I have worked on different places on sleep disorders, including the old Florida hospital, which now is Advent Health. And also my last work was with the integrative medicine, which was, including sleep disorders as well. And right now I have my own practice. I have a telehealth primary care practice focused on sleep, one of the main wellness that we do.
Okay. And so just to clarify, you said UCF, is that University of UCF?
Central Florida.
University
Yes.
of Central Florida. And you practice in Florida?
Yes.
Mm-hmm. Okay. So first of all, if you could let's just discuss COVID in general. Like I think COVID could be like an hours-long video, and then sleep could be a week-long video. So
that's so true.
I think we might be able to do more interviews like this and talk more about specific sleep issues if our viewers really enjoy this. But just let's talk specifically about patients with COVID long hauling. Have you had much experience treating that?
Yes, unfortunately, yes. Most people will recover, within 2-3 weeks, and they're gonna go back to their own self. But some people, they have like weeks and months with symptoms from COVID. I remember particularly one of my patients that she was positive for the PCR, and she needed to get back to work, and they would not accept her with a positive PCR. And she said, I'm feeling well, and they cannot go back. So that's one scenario. The other scenario is they're negative. They don't have the positive lab test anymore, but they feel so bad. They're still with symptoms, and you can just, imagine how many different kinds of symptoms that can be long haulers. But you know what? The most common that you see is like body aches, like, cough. Cough is one of the last symptoms to go away. And not to get too fast on the subject, but sleep issues is one of the long-term consequences of COVID. So it's a lot on that topic.
Yeah, and I would imagine just the anxiety of sort of seeing yourself becoming a possible long hauler, that alone could create some sleep issues, I would think.
Yeah.
What percentage, if you had to just guess, and your practice is your one sample and it's kind of an anecdotal number, but what percentage of people would you say become long haulers?
Oh, not many. I would, that would be a long guess. I would say less than 10%. Most people recover well. Yeah.
And of the long haulers, have you had any of them eventually recover, or have they stayed long haulers?
Most of them eventually recovered. One of the symptoms also that was long-term was the smell and the taste, that couldn't go back, fast enough. And that was very disturbing too.
Okay. So do you see COVID, any kind, whether it's long haulers or not, do you see COVID affecting people's sleep? And then what about long hauling?
So it's interesting. Way back in the beginning of COVID, I had some patients that had problems with insomnia before. They would call, come for a consultation and all of that. And they say, Dr. Lima, my sleep is so much better now because now I don't have to go to work. I'm home, so I can sleep more. I don't have the problem with, with the, commute and all of that. So it's been better. So I got all excited. I said, oh, something good about COVID. It didn't last long because, as months went by and people staying home and getting, because, in the beginning, if you all remember, we couldn't tell how long we had to be, with social distancing and with so much, it was so unknown for all of us, including the doctors. We didn't know what we were dealing with. So eventually we saw that the consequences of COVID with sleep issues was really severe, because like you said, anxiety, all the, social distancing can have like depression exacerbated, and people that have never had mental issues before, they start having mental issues because, not only isolation, but, economically, many people got furloughed or lost their jobs, and the finances was, a big thing too.
Yeah. So are there any evidence-based treatments, or do you find yourself sort of winging it when it comes to treating these people?
So that's a very good question, Sandy, because when you think about treating sleep disorders because of COVID, and sleep disorders just regardless of COVID, it's pretty much about the same. The only difference is we need to focus more on mental health. And most of my patients that I treat for sleep, I send them for counseling as well. And that is a big, big difference, because if you cannot treat what's causing the problem, most likely is not going to be effective. So it has to be, some investment of time and resources to address everything that, it has to do with treating for insomnia. But just, to be true to your question, the best treatment for let's just mention insomnia, because that's the most prevalent, is cognitive behavioral therapy for insomnia. Because some people, they just want to come for a consultation and say, oh, Dr. Lima prescribed me a pill. I just want to, I just need to sleep. And I do prescribe medication sometimes because, sometimes you just need that, acute phase to be abated. But long-term, it's cognitive behavioral therapy and a lot of other sleep hygiene and stimulus control. So it's very comprehensive. It's not just like one quick fix.
Okay, and so, when you say cognitive behavioral therapy, you're talking about things like learned behaviors and associations and routines.
That would be this the stimulus control and the sleep hygiene. So the cognitive behavioral therapy is a specialized treatment with a sleep specialist or psychologist that are trained for cognitive behavioral therapy for insomnia per se, because you can have CBTI for CBT, cognitive behavioral therapy for other reasons, but the CBTI, which is the specifically for insomnia, it's different. So it's pretty much counseling, and then you have homework to do, and it's very comprehensive and very effective.
And so, what kind of results do you see with it?
So the American Academy of Sleep Medicine, which I am a member as well, the number one first line is CBTI. So the results are not overnight. It may take a few months, sometimes, really long term, because most people talking about COVID, it might be something more acute, but talking about long-term insomnia, some people, they have that for years. Sometimes they never address that with their doctor because they don't think that's important. And then you kind of learn how to live with a sleep deprivation. And that can affect your cognitive function. It can affect your relationships. It can affect your learning abilities, and you just don't know why. And that's my, my passion. My patients that I see for any reason, I always ask them, "How is your sleep?" Because sometimes they just don't say anything about it.
Mm-hmm. So, what kind of success rate would you say? I'm sure it varies from patient to patient, but 50%, 70% amongst the people who do the work?
That's, you like your numbers, don't you?
Well, I
There
mean,
is,
a nurse
I wouldn't be able to tell you exactly, but I would say more than 60%, they have, success, like, they just completely resolved. Some of them, they have success for a while and then they need therapy again, some of them. But you know what? Because we're humans, human beings, even though we know what to do, sometimes we don't. And I don't know if you know that, Sandy, but I have some of my videos out about, tips for sleep. And I talk about my personal story because as a sleep doctor, here I am having sleep problems myself. And then I realized that I was not doing for myself what I was telling my patients to do.
Yeah.
So that's human beings, we sometimes don't do the things we know we have to do. So
Right.
that's why the percentage is hard to say, but some people do really well. Yeah.
Okay. So speaking of which, I'm going to put down in the description box a link to Dr. Lima's channel. So anybody who wants to check out your videos can take a look down in my description box and click on that.
Yeah, I have quick videos, like 3-4 minutes. I have 10 tips. So each tip is one video and it's really cool.
Yeah, that's nice. Okay, so I guess we've already pivoted a little bit away from COVID and talked about sleep in general. What is the root cause of the most common sleep issue that you treat? I would imagine sleep problems fall into categories just like any other kind of problem.
Yeah, stress is number one. And some people don't realize they are under chronic stress. And that's what COVID did for a lot of people. That's what we call the chronic stress. And it's just, sleep is such a, it's so complex. It has so many things that affect the sleep. That's why we're still studying. And if you go to the conference and say, well, we still don't know why, this thing happens one way or the other. But stress is always underlined. It's just, amazing how much that can affect the sleep. And that's why COVID has been such a big thing,
Yeah. And so for stress-related sleep, you feel that the cognitive behavioral therapy is king.
It is because this is the evidence-based. Like you asked me, what is the evidence-based treatment from the American Academy of Sleep Medicine? The cognitive behavioral therapy for insomnia is number one. Like I said, sometimes you do need medication, but just for a while. I just want to go, a little bit on that topic on the medication for acute circumstances, like, if you have a divorce, you lost your job, or somebody died in your family, something really, a traumatic event, you may need medication to help you sleep because your mind can just not, disconnect and relax to sleep. But for long term, don't count on a medication that's going to make you sleep for months and months and years, because they work for a little while, but in the long term, they don't work anymore. You up the dose, you change the medication, it doesn't work. So that's why the cognitive behavioral therapy is the number one.
And I would think also that not only do they not work, but then withdrawing the drug, that can become its own problem too, right? Where people
But usually when we withdraw the drug, it's like they're not sleeping anyway. The drug's not doing anything for them, Yeah.
Okay. So finally, can you, besides anything else you would like to say to my audience, which is profoundly interested, well, most of them are profoundly interested in all things COVID, because that's just, we're sick with it already. And especially this Delta variant now. We thought we had some breathing room, and now here comes this Delta variant. So let me digress. I'm wondering, have you treated any known patients with the Delta variant?
Not yet. I hope not. Those are the people that are going to the hospital and dying because, as you have, heard, most of them are the ones unvaccinated. So that's really a problem.
Yeah. Although there's some that they're finding with breakthrough, like to some extent, it either evades some of the vaccines or some of the vaccine, maybe the immunity wanes. I think they're still parsing all that out.
There will be a video on itself just about the vaccines.
Many on my channel. So finally, can you tell us your top 3 tips for better sleep?
So, like I said, I have 10 tips, the top number, let's say if I have to pick, 3 of the 10, I would say make sure that you have a bed routine. But for that is, a sleep schedule. And that's so hard because you have families, we have situations, and we end up sleeping different times, waking up in different times. But if you have problems sleeping, a regimen for sleeping at the same time and wake up at the same time every day, including weekends and holidays, that will align your circadian cycle. And that's a thing that many people don't pay attention. They don't know that's a thing. So it is important to go to sleep and wake up at the same time. The other one is a kind of a funny one, but it's really all scientific evidence. I'm not just coming up with that from the top of my head. Use your bed only for 2 things that start with S: sleep and sex, nothing else. Don't read in bed, don't eat in bed, don't scroll your, social media in bed. When you go to bed, it's just to sleep or have, fun, having sex. That's all good, nothing else. So it sounds simple, but you'll be surprised how many people don't pay attention to that. And the third, what is that?
No watching movies right before you fall asleep. No.
And that's the thing, Sandy. Sometimes people say, wow, that doesn't apply to me because, I sleep better when I'm watching TV, in bed. The thing is, if you don't have any problem with sleep, you don't have to do anything. You can do whatever you want. But we're talking about, we're talking to people that need help with sleep. So the third one that I would pick, and that's a big one, is meditation. Meditation, I would say there will be, a video just about that, because meditation will help in so many ways. It helps to relax. It helps to take your mind off your, racing thoughts. And that was one of my problems. My racing thoughts were like, oh my gosh, I cannot stop thinking about all the things that I have on my plate. So meditation will help with that. So yeah, I could talk a lot about that, but I know we have a limited time.
Well, that's interesting that you bring that up. We'll kind of close with that because on my channel, I have done a couple of videos on meditation.
Wonderful.
And I have been a longtime practitioner of meditation, like 20 some odd years. And I also talk some on my videos about intermittent fasting. And I think of those as the same thing, that not as they would relate to sleep, but I think that fasting is to the body what meditation is to the brain. It's a way to clean it out. It's a way to reset, and it's a way to sort of get in touch with a subconscious. Like breathing and blinking are the only things that are both conscious and subconscious. And I think it's awesome that you had that in your top.
Very much. It's a big one. Actually, I don't know your recommendation, but I recommend my patients to just get YouTube. They have wonderful free, meditation, guided meditation. So just make sure that you look for mindful guided meditation. And then you can choose for sleep, you can choose for wake up. There are so many things, manifesting, your good life, and so many good things out there for free,
Yeah, it used to be if you could read, you could learn to do anything. Now all you have to do is be able to watch YouTube.
That's right.
Yeah. All right. Well, I so appreciate your time. I on behalf of my viewers, I want to thank you so much for taking time out of your busy day. I see you're still in clinic, and I thank you so much for your information. And I will encourage anybody who has any questions about what Dr. Lima's had to say, please put them down in the comment section, and she and I can make sure to try to get to them if there's any questions. Again, I'm going to put your channel in my description box. And maybe we'll get to do this again and hone in on some more specific topics, subtopics.
Sure. My pleasure. And thank you so much for trusting, me and having me talking to your audience. I really appreciate it. Thank you.
Okay. Well, have a great day. And thank you again.
Too.
And to everybody else, until next time, be well. Goodbye.
Bye.